All right, good morning, everyone. Okay, I think we can do better than that. We're here for a groundbreaking. Good morning, everyone. All right, I'm Anthony McAuliffe, Deputy Director of Communications for the County Executive. Thank you all for being here as we break ground on a brand new health center for Prince George's County. So I'm not going to take up too much of your time, but we'll have a short speaking program followed by the official groundbreaking ceremony. So this morning, you will hear from, in order, Tara Jackson, the Chief Administrative Officer for Prince George's County. Then we'll have Dr. Matthew Levy, Health Officer for the Prince George's County Health Department. Following him will be Jonathan Butler, Director of our Office of Central Services. Then we'll hear from Ingrid Lewis, RN, who is the program manager for our county health department's immunization program. And then finally, to close us out, you will hear from county council member Ingrid Watson, who represents this area. So with that, I'll turn things over to our Chief Administrative Officer, Ms. Tara Jackson.
Good morning. Nice, brisk Monday morning. Good to see everybody. This is so exciting. So I bring you greetings on, can't see you when I have these on, but I can see my paper. I bring you greetings on behalf of the county executive, Angela D. Also Brooks. She would have been here if she could have been, but she does say hello and congratulations. This is so exciting. I want to take a moment to recognize all of the amazing people who are here with us today to help break ground on yet another new healthcare facility here in Prince George's County. Today we take another important step forward for Prince Georgians' health. We're breaking ground on a new county health center that will offer expanded services to our residents and improve the health of our community overall. So first, I would like to recognize several key members of our team for their role in getting us to this point. First of all, I saw him somewhere, our Deputy Chief Administrative Officer for Health and Human Services and Education, Dr. Somni Ariola. Our health departments, I don't think he's here, but our health departments in his absence, Chief Operating Officer Olalade Olakimi. Our Director of the Office of Central Services, Jonathan Butler, and his team, his real estate team. I see Akenna back there, and also Deputy Brown, who's in charge of all the facilities. Thank you, Deputy Brown. And other members of the team. This has been quite an undertaking. We have several staff members here from the current Cheverly Health Center. If you could just raise your hand if you're a current staff member, welcome. And on behalf of the county executive, I do want to say just thank you for all that you are doing and have done for Prince Georgians. I also want to recognize and introduce, if you haven't met, our new health officer, Dr. Matthew Levy. He is in his third month here with the county, and he was just telling me that he is not ready to leave yet. So we are excited that he likes it here in Prince George's County. And of course, I want to thank all of our electeds, to include our council member from District 4, Ingrid Watson, for joining us, for all of your hard work, and for your partnership. I see a couple of mayors here. Mayor Jordan, we're in your district, so thank you for joining us. Prince Georgians across our county depend on our current clinical facility, the Cheverly Health Center, for vaccinations, for HIV testing and treatment, and a number of other important services that have a direct impact on health. Critical staff for our county health department are based in our current clinic. As well, they are offering care for Prince Georgians while monitoring and analyzing public health developments. But the current clinic is too small and too old to meet our community's needs. This new 80,000 square foot, 5-story building we are standing at today is a milestone for our county health department and an example of how we have been able to put our federal COVID relief dollars to great use. This larger footprint will help us expand care and allow us to offer more services using new state-of-the-art equipment. And I know our health officer will have much more to say about the important benefits of this particular facility. But the truth of the matter is, this new clinic is a milestone for our administration's strategy to improve the health of all Prince Georgians. From the very beginning, in 2019, county government leaders, agency personnel, and community leaders came together to develop our Proud Priorities and Promises portfolio. These priorities represent our commitment, the Also Brooks commitment, to building and maintaining a 21st century county government infrastructure that improves the quality of life for Prince Georgians. And even in the face of a global health emergency, we kept our eye on that goal. The Prince George's Forward Task Force and the Police Reform Commission made additional policy recommendations that expanded our portfolio and laid out the path to emerging from the COVID-19 pandemic as a better and stronger Prince George's. The hard work has continued since then, both out front and behind the scenes. And today, I'm proud to say that 176 Proud Priorities and Promises that the Alsobrooks administration made to residents. Of the 176 priorities, 164 of them are either completed or ongoing. One of our overall Proud Priorities is healthy communities. And we are keenly aware of the challenges we face, the challenges that have been mounting for decades, but are still laser focused on expanding access to care for all Prince Georgians. The COVID-19 pandemic was hard on health departments all across this county. Weaknesses were exposed, infrastructures were shaken, people were overwhelmed beyond their capacity. But I'm proud to say that over the last couple of years, significant investments in our health department to support the infrastructure and the people have occurred. It was clear that Prince Georgians needed greater access to behavioral and mental health resources. That's why our county invested $20 million in the Luminous Behavioral Health Care Facility. And this new facility, I hope you've seen it, is helping us close the gap on behavioral health services. And in just a few months, in addition to this center, we're opening the Dyer Care Center, an important crisis stabilization center. The Dyer Care Center will be an outpatient facility that provides our residents mental and behavioral health care and helps us meet the needs of residents suffering from substance abuse issues. And we provided additional resources to help train, recruit, and equip our mobile crisis response teams to respond to residents experiencing mental health emergencies and to provide them with the resources and the care that they need. When the county executive first came into office, she knew that one of the challenges our residents face is a lack of access to care that matches what other communities have in our region. For example, Our residents suffer from worse cancer outcomes than any other Marylanders. One reason for that is lack of access. That's why we secured $67 million from the state of Maryland for a new cancer center. And once that new cancer center opens, we fully expect that Prince Georgians will have better healthcare outcomes. Today, we are pleased to be here breaking ground on yet another new healthcare facility in Prince George's. This administration and our partners have shown time and time again that investments like these are possible when we work together and choose priorities that promote the health and well-being of our residents. I want to once again thank all of our partners and all of the public servants, and I'll say that again, all of the public servants who helped make this new healthcare center possible through their tireless efforts. I know this was not easy, but our team was committed and we got it done. I'm excited about the future. I know that the county executive is excited about the future. Looking forward, we are going to keep fighting for additional healthcare resources for Prince George's County. We're going to keep offering Prince Georgians new opportunities to receive care close to home. And we're going to stand together and build the kind of healthcare infrastructure that our residents deserve. Thank you. And now I want to turn things over to our new health officer, Dr. Matthew Levy, who will share more about this facility. Thank you, sir.
Bring it down a little bit. Good morning, everyone. So I just want to say it's very exciting for me to be sort of taking the helm after all the hard work was done to get here. So it's very exciting for me. Thank you, CEO Jackson. As you know, as you heard, I'm the new health officer for the Prince George's County Health Department, and I'm so glad to be here as part of the team whose priority is making Prince George's proud. I want to begin by thanking the county executive for her vision in seeing the critical need for upgrading healthcare provisions in Prince George's County, and by creating a collaborative county approach to address this. Everybody working together, which is really how we should be. I want to thank Councilmember Ingrid Watson and our other county council members for your support and leadership. And I also want to thank the mayors for their support as well. I would like to thank Diane Young and her team from Family Health Services Division, as well as Evelyn Hoban from our Environmental Health Division, and Dr. Jacqueline Somerville and her team from our Behavioral Health Division for all their hard work and dedication to our residents, and for putting a lot of energy and time into helping to make sure that what we have moving forward is really exceptional. Lastly, I want to thank Director Jonathan Butler for his leadership in coordinating all these moving parts, and there were a lot of them for this important endeavor. This collaboration is a true commitment to Prince George's County residents during this time of great need. As the county health officer, it is my mission to improve, promote, and preserve the health and well-being for all Prince Georgians. Therefore, it is no surprise that I am very excited about this project and the difference it can make in our communities. What you will see here is not just a building for residents to get the care they need, but it's a big first step in enhancing healthcare services in Prince George's County so that we can focus on Prince George's overall health and well-being. This building will house a broad spectrum of services, including behavioral health, dental care, illness treatment and prevention, immunizations, and reproductive health resources, as well as many other services. I am excited about the path we are on. By investing more in public health, we are ensuring that there is greater local access to the healthcare residents deserve. Thank you very much. Be healthy and be safe.
Good morning, folks. How are you? Happy chilly Monday. Probably a bit chillier for you Commander fans, I would think, right? I'm sorry. Hey, look, he had to go there, didn't he? Ooh, it's factual, right? All right. Thank you so much for joining us this morning on this momentous occasion as we break ground on this new Prince George's County Health Center. It is truly an honor to stand before you as the director for the Office of Central Services, and I extend a warm welcome to each of you. So thank you for coming out. We are deeply honored, shall I say, to have with us our county chief administrative officer, Tara Jackson, which has been truly committed to the well-being of Prince George's County. How about a round of applause for Tara? Thank you, Madam CAO. Appreciate that. And certainly thank you to the council member and Mr. Mayor for coming out to support. Thank you so much. Really appreciate it. I want to also thank you. Yes, absolutely. I want to also further acknowledge, I know their names were called out earlier, but certainly to my OCS team, to Kenny Udejafor, who's the Chief Real Estate Officer and Property Administrator for the agency, as well as, I don't think Barath Kortagari is here. He's our Associate Director for CIP, our Capital Improvement Program, as well as certainly our Deputy Director for Technical Operations, Michael W. Brown. How about another round of applause for them? This was indeed no light lift, folks. So I also want to acknowledge and thank our current architect team. Not sure if they're here, which is Delta and Gensler. Is anyone here from Delta and Gensler? So the architect team will be responsible for really transforming this and really creating a spectacular design over the next several months for which was going to yield just a phenomenal building. And I also want to thank our prior feasibility team, Delta and Leo Daly, which was responsible for actually locating this site for us and doing a lot of the pre-design work, site location, site analysis. They were programming of requirements. So they were sort of the foundational piece for actually getting us here. So thank you to each of you for getting us here today. We're all very appreciative. As we gather here this morning, we do so with a profound sense of purpose and accomplishment. The groundbreaking of the new Prince George's County Health Center represents a powerful symbol of our collective dedication to the welfare of our citizens and to the betterment of our community. This building, acquired for about $9 million and to be further enhanced by an additional $18 to $20 million, stands as a testament to our promise, a promise to pursue projects that promote the priorities of our county executive and ultimately the benefit of the people and the businesses of Prince George's County. Our timeline for this project consists of a design phase that will take about 12 months roughly. So that's going to put us into late fall 2024, followed by the procurement of a general contractor to perform a complete interior construction build out along with the exterior upgrades. And so given the scope and scale of the project, the interior construction build out is expected to be about 12 to 18 months, which will put us into late fall or winter of 2025. And this will position us folks to be back here in that following spring for a spectacular ribbon cutting of our new facility, our new Prince George's County Health Facility. What you see in front of us are optional exterior skin upgrades that we're thinking about. So we'll probably end up doing some due diligence to determine just what we can afford and actually what's going to be the best value for us. But these are some options in terms of what the exterior is going to look like. So love to get your perspective and maybe your choice at the end of this. So, and folks, I'm going to make a bold promise that the general contractor or construction firm that we select down the road from now to build out and deliver this new county health clinic, I'm going to make a promise that it's going to be a county-based small and minority business. You can count on it for sure. But this endeavor is not just about bricks and mortar. It's about the people we serve. We agree with the sentiment of our colleagues in the health department to build out that, down the road, or shall I say that to health department, that when we say that this project is about ensuring that every resident in our beloved Prince George's County has access to the highest quality of healthcare services. So we are certainly in lockstep with that particular sentiment with our colleagues. So today we embark on a journey that will strengthen our community, improve our healthcare infrastructure, and create a welcoming state-of-the-art facility. Our aim is clear: to enhance the overall well-being of the residents and to provide them with the healthcare facility that they deserve. In closing, and as we break ground today on this magnificent facility to come, let it be a symbol of our commitment to progress, our dedication to our community, and our unwavering resolve to keep the promise we make. Together, we will build a healthier, stronger, and more vibrant Prince George's County. Thank you so much for being here to witness this significant moment. Together, we will continue to make great history and strides within this great county of ours. And again, thank you. And let's get on with the groundbreaking. Thank you so much. Really appreciate it.
All right. Good morning, everybody. Good morning. It's a nice, chilly day. So, good morning. I am Ingrid Lewis. I'm the program manager for the immunization program within the health department of gorgeous Prince George's. I'm thrilled to announce the opening of the amazing new health center here in Prince George's County. When I say I'm thrilled, I'm very thrilled because I work in the Cheverly Health Department, and we are in dire need of a new building. I'd like to thank County Exec Angela Also Brooks and our local leaders for their commitment and support in making this health center a reality. This health center will provide essential healthcare services to all of Prince George's County residents, including behavioral health, dental care, and much more. Not only that, but we are also looking forward to reduced wait times, yes. Improved staff to patient ratios, absolutely. And access to modern equipment and telehealth services. We're in the 21st century, and post-COVID, yes, we do need telehealth services. This aligns with our mission to provide superior care and deliver an enhanced patient experience. For us here at the health department, this new center represents the culmination of countless hours and tireless efforts from a dedicated team. Yes, we all are. As someone who has seen the work behind the scenes, I'm deeply proud to be part of this transformative journey. I invite all of you to join us in celebrating this pivotal moment in our community's healthcare journey. It's a moment worth celebrating. Yes, it is. Together, we can look forward to a brighter future for healthcare in Prince George's County. Again, thank you all for being here today. I am genuinely excited about what lies ahead for healthcare in Prince George's County. Now, one last thing. Someone asked me, talk about my career in Prince George's County Health Department. So I am excited to say when I think about it, it gives me warm, fuzzy feelings My career began in Prince George's County in 1999. Very dear to my heart. I began my career at the health department, and I started in the program, the breast cervical cancer screening program. That program meant a great deal to me because at that time, we serviced uninsured women who some unfortunately were diagnosed with breast cancer, some were diagnosed with cervical cancer. But because of the breast cervical cancer screening program, we were able to get them into services that could give them the treatment and provide services that they need. So we save many lives. So that program is amazing. As my career continued, I departed the health department in 2006, but I returned quickly in 2011 because I knew my work wasn't finished here. So when I returned in 2011, I walked into, at that time, what was called the Infant Mortality Program and the Child Fatality Review. That program was really needed, but I can tell you, I'm so glad I don't deal with that today because I'd be crying with what we have going on in all big cities. But today, in 2023, I manage the immunization program, which I enjoy immensely. The number of children we see thousands of children a year, making sure they get the vaccinations that they're needed, and so that our communities are protected because we are preventing childhood diseases. The biggest part of my career was COVID. Ooh, lots and lots of hours were spent doing the work for COVID. I'm happy to say I think the health department deserves an A+ because the health department did an amazing job. They did an amazing job protecting the people here in Prince George's County. So with that being said, I'd like to say I'm so glad we're getting a new building so that we can continue the great work for the gorgeous Prince Georges.
All right, I stand between you and the shovels. So I cut my hour-long speech down to about 2 minutes. So good morning again, everyone. And I'm so happy to be here on this groundbreaking day in the wonderful city of Greenbelt and Councilmanic District 4 in Prince George's County. As we stand on the future site of the County Health Department's new health center, I want to thank our county executive, Angela Alsobrooks, for her leadership and the invitation to join you here today. I also want to acknowledge my friends, the great leaders here in Greenbelt, Mayor Emmett Jordan and the members of the Greenbelt City Council. Round of applause. Thank you very much for being here. I know you will all agree that Greenbelt, with all that it has to offer, is an ideal location for this new state-of-the-art healthcare facility. Today's groundbreaking for the new health center is a huge step towards addressing our shared priority concern for improving healthcare and service delivery. This facility represents yet another significant milestone in our continuing journey toward much-needed healthcare transformation in Prince George's County. Before my election to the County Council, I had the privilege of working in healthcare for Children's National Hospital, and I saw firsthand the growing health needs of our community, especially in pediatric care. And I must give Inger and her crew at the immunization clinic a round of applause because we were able to get the much needed COVID vaccines that we needed at Children's National during that time. So thank you so much. Thank you to Prince George's. In that time, I also witnessed the powerful impact of our work together, and I'm certain that the new County Health Center in Greenbelt will be a strong complement to our network of existing medical facilities, to include the University of Maryland Bowie Health Center and the Rehabilitation Hospital of Bowie in District 4, greatly enhancing our ability to meet current and future community needs for healthy residents and communities and address serious health disparities. Our work together to build this new health center and to see this project to completion is a perfect example of the remarkable things that can happen when we work in partnership to provide the residents with all important access to quality health care. My heartfelt congratulations again to County Executive and her wonderful team, and to every stakeholder with any role in building out this new facility. Another game changer for Prince George's County, creating new possibilities for healthy residents and communities and positive impacts for our economy. As a member of the County Council representing the awesome communities of District 4 and the county's Board of Health addressing health policy, I am proud to continue to work alongside all of you. Remaining committed to our strong and unique collaboration is essential in achieving a strong finish and implementing long-term solutions to better serve the critical health needs of our residents. I'm excited to work even harder, and I'm ready to get those shovels in the proverbial ground. Thank you very much.
All right, so the council member is correct. We are ready to go immediately to the groundbreaking. So
Everyone here? Right here?